and gentlemen, thank you for standing by. Welcome to the Foundation for a Healthy Kentucky 2013 KHFI Evaluation Overview webinar. During the presentation, all participants will be in a listen-only mode. Afterwards, we will conduct a question and answer session. At that time, if you have a question, please press the 1 followed by the 4 on your telephone. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Monday, June 16, 2014. I would now like to turn the conference over to Jessica Lawrence. Please go ahead.
Thank you so much. Hi, everybody. Good afternoon. This is Jess. I really appreciate you being on this call/webinar with us today. And Ian Mackey and Maggie Jones will be leading the webinar from the Center for Community Health and Evaluation. Most of you have met Ian and Maggie, and I'm going to turn it over to them, but I just wanted to say thanks for being here this afternoon. I'm really looking forward to their presentation on the 2010 to 2013 evaluation of the SIF project. And as all of you know, you've been through recently our workshop that Lisa Johnson did on storytelling, and I think that some of these components and knowledge pieces that Ian and Maggie go over are going to be even more helpful for you to share your story as we move forward and talk about sustainability and moving ahead in your own communities. So without further ado, I'd like to introduce Ian and Maggie. Thanks for being here.
Thank you, Jessica. Thank you, Jess. It's Ian, everybody. I'm here with Maggie Jones.
Hi, everyone.
That was Maggie.
I didn't know he was going to cue me there.
No, I don't give Maggie much heads up. I try to give you guys better heads up. But we wanted to take some time, since we weren't able to be with you in May at the convening that you recently had with Lisa, to talk about the evaluation report that we submitted to the Foundation really back in January of this year. And we've had some revisions going on with the Foundation staff, but then finalized it for their board meeting in the early spring, and then wanted to present it to you at the convening. That didn't happen, so here we are 1 month later on a webinar to do just that. We have done one of these presentations before last year when we had submitted the first sort of formal report to the Foundation, which covered the first 2 years of the grant funds. And this is just a summary report of the additional year of the KHFI program from the perspective of all the evaluation, all the sub-grantees, as well as our own inquiry to evaluate some of the outcomes that were of interest to the Foundation beyond what's going on at your sub-grantee level. Beyond this, oftentimes you guys are very familiar with your own programs and the evaluations that were done for your own sub-grantee project. But there's a bigger story to be told, and that's the story of the KHFI initiative from the Foundation's level or from the statewide level, the intermediary level. And that's what this report attempts to do. It attempts to summarize many of the outcomes and activities of the projects that were going on, but then also try to take a higher level approach and look at some of the overarching goals of the program and see how well it's doing and what might be done to improve those outcomes or to make them more targeted towards what the Foundation had hoped to do. So we're going to go through our report. I hope all of you have seen it. There was a PDF distributed last week, I think by Jess, to make sure that you were familiar with what our findings were and what report we would be reporting on today. So like many other project reports, our KHFI evaluation report follows an evaluation plan, and it includes both background on the initiative and sub-grantee selection, as well as the methods that were used to evaluate the overall KHFI report. And the parts that I'm going to focus on today really have to do with the outcomes, which were broken up into sort of 3 general categories. We wanted to report on your own progress and accomplishments within this report. We wanted to take a step back and see what impact those sub-grantee programs were having on the initiative's goals, as well as evaluate what the experience of participating in KHFI was like for the, in the SIF was like for the Foundation. And just like your evaluation reports, ours follows a logic model that describes the KHFI program, and I bring it up for you one more time. You've probably seen this before, I'm going to try and point out on the, let's see, do you have a little arrow here? So mostly what we were talking about in our evaluation report has to do with outcomes that happened in the intermediate and short term. These were the goals that we had established would probably be accomplishable by you within the first few years of your programs. This would lead towards some more intermediate outcomes in which you sustained the plans that were valuable for sustaining, you produced local health improvements, you were able to formalize relationships and make collaborative decision-making processes within your project with your community, and that there would be learnings about policy that would help the foundation set its policy actions in the future. And then hopefully what the SIF and other programs wanted to see was a spread in successful sustainable models and strategies. They wanted to see development of community-based health solutions rather than top-down health solutions, things that came out. And important to this initiative were the policy, systems, and environmental changes that would happen to local health systems that would create a more equitable, healthy lifestyles in your community and promote health equity. And that equity would lead to better access to health services, would create environments that support and promote healthy lifestyles for all Kentuckians, and ultimately improve the health status of Kentuckians. So let's see what happened. The first thing we wanted to report on in sub-grantee progress was sort of how you did as far as reaching the populations that you had sought to reach. And what we saw was that there was, as expected, a fairly rapid rise in the number of people contacted or touched by KHFI projects in the first 2 and 3 years. And that accelerated. It started to mellow out sort of around here. And that's, of course, because some of the people did not continue, some of the original projects did not continue to report what they were doing in years 2 and 3 of this project. So we aren't able to include their reach in this. But nonetheless, reach expanded even on a decreasing number of projects over time as they got more established in the community. And then not only was there reach in terms of people, but there was a large geographical reach of this program. KHFI was originally intended, as you had stated in your projects summaries, to basically do outreach in 33 counties primarily. But because of migration and the way people move about and that some of your programs were more regional in their intent, you actually reached Kentuckians in 91 counties as opposed to just 33. And that's a pretty significant increase over what was anticipated, and it was great to see that. Now, along with reaching people, we'd hope to see that there would be changes in the behaviors or in the outcomes or in the health of people who were touched by KHFI programs. And through our evaluations of your reporting and as well as interviews with you, we really did see improvement in all programs in many of these areas. Now, not all of you were working to do workforce enhancement, but those of you who were trying to increase the number of primary care providers or health providers available in a rural region were successful in doing that. But all of you reported impact on access to the services that you were provided. Those were either medical services or health services, or in the case of Meade County, those were access to community-based physical activity solutions. And then of those people who were reaching out, all of you reported that you were having significant impacts or successful impacts on people's health or people in your community. We were also curious about what your experience was in implementing your programs, and so we asked about that significantly in the evaluations that we did of you. These were our interviews with you. And in the report, we decided to sum this up by giving each one of these projects a one-page program summary where we summarize the description of your program and your goals, the implementation of the project. We tried to pull out any success stories or successes, wins that your project had had in its implementation, and then spend a little bit of time talking about the future for your project, whether it was going to scale, how you were intending to sustain it, whether you were intending to implement enhancements to your program. And those are all covered in these one-page summaries that appear in the formal document. Beyond that, we were also curious about success factors, things that you found that were helpful in implementing your project successfully, and those things that you found that were challenges. And the success factors really were aligned fairly closely with what they had been in the previous years in our interviews with you. One of them was that you had excellent program staff and organizational support from within. So the places which were supporting these projects were doing so well, and your staff was very much aligned with you. Many of you identified sources of support from the community that were instrumental in your success, as well as being able to adapt your program within this flexible and changing landscape, with health reform being implemented and policies being changed and finances being tighter or looser depending on how you were doing. And then also some of you called out that there was a positive effect of participating in the KHFI, that gave you some legitimacy to your project and your goals and aligned you with a larger project and a larger initiative. And the challenges were pretty common as well. Many of you reported that the time it took to develop infrastructure and partnerships was not always as swift as you'd planned, but you were able to adapt to that. That was also a challenge, which was when things didn't work out the way they were, you needed to figure out how to adapt and change course in order to keep up with your goals and meet your targets. Your targets themselves were a goal. They were very ambitious, and they were all built upon a projection of what your project would look like at a certain time. But you were also able to make changes into your program implementation that allowed you to reach more people or reach different people from who you'd originally targeted. And then sometimes it was a challenge to communicate within your community about what this project was that you were doing and what the KHFI was in general. So these are themes that are important for the Foundation to know about in order to provide the appropriate support to you in implementing projects like this. And then they're also good for you to pay attention to as well, because this will hopefully inform how you approach projects like this in the future. I'm just going to keep on going here. You know I can talk forever. But I wanted to get through sort of what our findings were and have some time at the end that we could turn this over to you for questions. So at the level of the project, at the level of the initiative, certainly everybody wanted to create projects within their systems that would be ongoing, but this was very important to the Foundation as well, and we wanted to know sort of what elements were being tapped, what tools were being used, and what strategies you were employing in order to sustain your project. And so we asked you this in interviews that were done annually. And what we saw was that there was a pretty consistent amount of internal grant writing going on, sort of seeking other forms of external support for your projects, as well as going to individual community organizations who were taking an advancing role in implementation in your project. Some were helping out as volunteers or providing in-kind support. Some were actually also providing financial support where others had done this before. And then also advocating for your program. Now that you have a couple of years of experience with it and some progress made, it's good to talk about that within your organization and see if there's ways to ally with internal initiatives that can support your project. Then to some lesser degrees, people were using other fundraising strategies, charging user fees or seeking reimbursement for the services they provided. And very few, just one actually, reported that advocacy and policy solutions would be implemental to sustainability. And this had a lot to do with policies around the implementation of the Affordable Care Act, as well as Medicaid reimbursement and Medicaid policies surrounding integrated care and dental reimbursement, dental training. So we're taking this beyond the level of your individual projects and really trying to synthesize things at a higher level for this, which we also did around the areas of community engagement, which were a very important part of the KHFI initiative, which was that they wanted to fund projects that were already known or could garner support within the community. So this year, for the first time, we reached out to you and we asked if we could speak with some of the people who you found were instrumental in your project implementation and in supporting it. And we spoke to informants that you had identified, people who were who you reported would be good informants about your project. And what we learned was that although all of the community was aware of your project or engaged with your project, that engagement took on various different facets and different aspects, some which were more dominant than others. And it really depended on the type of project you had and the role that you needed community to play. At the very basic level was an awareness of your project within the community. And I wish I could say that this was 100% uniform across all of the projects, that all of the informants were equally well informed about projects and aware of what they were doing. But that wasn't always the case. In some cases, some of your informants had felt very, very well included in the early stages of planning and developing of this project, but hadn't heard much about it since then. But then others were providing active support or had supported this organization, your organization's implementation early on. Some of that support was continuing to go on and evolve and become even more intense. Some of it had dropped off, and that was appropriate because it was really needed to gain gateway or access to the communities in which you were working, and so that support, the necessity of that support waned over time, but certainly could be employed later on. And then there were those organizations where the community was actually actively engaged as a partner in the project, meaning the project really wouldn't have happened if there hadn't been partnerships with community organizations other than the foundation. And these were organizations where the services that were provided relied heavily on volunteers or needed to access a specific part of the population which wasn't readily accessible through other means like the media. These might be pockets of poverty in Louisville that could only be reached through trusted community organizations who would host KHFI activities. This could also be partnerships with schools that could help provide data for some of the program participants that were active in KHFI programs in those communities. But the idea is that community engagement can take all kinds of different shapes, and that it has to exist in various different forms in order to accomplish different functions. So if you find that your projects are not having the type of support or gaining the kind of advantage that you'd hoped it would through your engagement strategies, you might look at how you could expand awareness or improve support or develop partnerships that could help in sustaining or growing your programs. Now we're talking about support. We did, I might have already mentioned this, but we did see various levels. I'm having a little bit of a slide problem here. Okay. So awareness and support really had three different aspects. And as I said, it wasn't always bad that people were just minimally aware of a project. If the project was seeking a specific target population, for example, Home of the Innocents was really looking for a Medicaid population of pediatric children with special needs. It would be good for those populations in Louisville who served those children to know about the programs. But if you were operating a food kitchen serving senior citizens in East Louisville, it wouldn't be an important program for you to be aware of. And so those levels of awareness wouldn't necessarily impact program performance. But just know that engagement through awareness and support can be variable. It can be increased over time. It can decrease over time. And the idea is just to be aware of it and be sensitive to it and make sure that that level of community awareness and support is adequate for the program's goals for that program awareness and support. So one of the things we talked about when we interviewed you was to ask about sort of how you were exploiting or using your partnerships in the community. And these were the basic 6 areas where we saw different elements of community partnerships. Those that provided funding and support, those that provided staff and volunteers, those who supported you in doing outreach to gain awareness, raise awareness of your program, doing so to build community support, those who engaged with you on a more strategic level and helped you sort of plan your next steps within your program, and then those partners that were very much involved and really played a role in how this project would fold out and be implemented in your community. Now, all of these things did not stay static over time, and there were changes in these from one to the other. I don't have a slide about that, but there were a couple of areas where this went up. Often as funding was waning or your ability to seek program funding through the foundation was starting to be limited, your need to seek funding from partnerships outside of the foundation increased, and that's what we saw. And then also, as support from community was needed to sustain your projects, not just funding from community sources, but actual physical or emotional or holistic support, that was also measured to increase in your partnerships over the period of the 3rd year of the grant. So the foundation was very interested in improving health equity in the Commonwealth through these programs, and that really was allowed to be defined by individual sub-grantees as they saw fit or as they saw their program appropriate, how they thought that to be appropriate for their programs. So one of the common things we saw was just making services more accessible to those who had been previously underserved, was an important part of a Kofi project. And this is a quotation from one of the executives at King's Daughters Medical Center. They operated the mobile screening program in Appalachian counties. And really, they thought that the work to bring services to the uninsured, to rural people, was happening through an equity lens. Their program has been very successful in reaching people with limited resources by taking these services to where people are. And so by reducing the barriers that people found to get services that they needed to sustain their health, King's Daughter felt that they were providing a service through a health equity lens. The other main area of outcome of impact for this project from the Foundation's perspective was to be able to see changes or get information on how to inform health policy within the Commonwealth to make it a healthier state for its residents. And the way we saw health policy being impacted by these programs was through a variety of strategies. The main one being how to set up appropriate reimbursement for the services that were being provided. Oftentimes these were innovative services like telemedicine or enhanced services in dental care that really weren't covered by existing legislation or existing healthcare policy and really needed the attention of the policymakers in order to understand what could be done to make these programs more successful. And so there were efforts being made to inform health policy around reimbursement, as well as licensing and certifying practitioners. Again, this had to do with oftentimes trying to get inclusion of providers under Medicaid within the Commonwealth, in the case of dentists and community health workers, for example. Also, the emphasis on making sure that there are fewer disparities between those who are those who are struggling with mental health issues as well as physical health issues, doing as well as those who are not. Let's put it that way. And one way one policy strategy that's been looked at and is being investigated through a KOFI program is by really integrating both behavioral health services and primary care services in a similar location or in a similar setting. And so policy needs to change in order to facilitate those types of things. Maggie's got her hand up.
I just wanted to jump in here because I think this is something that the Foundation and its other initiatives is really interested in looking at. And in the Foundation's initiative on promoting responsive health policy, they're really seeing the work that you're all doing as kind of demonstration projects to look at different models of improving care and doing care differently. And so the challenges that you've all cited related particularly to Medicaid policies and doing some of these things Ian is talking about have really informed how the Foundation is thinking about policy going forward. So while you may not sort of see yourself as taking on some of these policy the challenges that you faced related to Medicaid policies is informing the Foundation's work going forward through its other initiatives. I just wanted to add that piece.
Thanks, Maggie. It was said also by one of the grantees that if healthcare reform goes through as it was stated, there would be an emphasis on prevention, and with health insurance for everyone, health systems have to make a shift from fee-for-service payments to preventive payments. And so this is where they are trying to show the value of providing these preventative services as they tie into providing healthcare services to a previously uninsured or a previously non-Medicaid population. So these were the main areas of impact that the Foundation was hoping, the outcomes that the Foundation was hoping to further with this project. But there were also some experiences that needed to be captured and that we really wanted to understand, which was what it was like from your perspective to have been a part of this cohort and to have been a part of this funding initiative. And so through our interviews for you, we were able to identify some common themes among KOFI grantees about what it was like and how they were able to be successful through the KOFI program as opposed to through other funding streams or through other experiences they've had. You pretty universally felt that programs had been implemented sooner and more effectively than they would have been without KOFI support, that those services and reach were deeper and broader than they would have been had there not been support, and the credibility of being grantees of the Foundation for a Healthy Kentucky and participating in the Social Innovation Fund added credibility to your projects and allowed you to gain better access to support from key stakeholders. I think there was a nice summary statement that was made in one of our interviews with one of the sub-grantees who said, overall, it's been a very challenging experience, but I wouldn't have traded it for the world. We wouldn't have been able to give this tremendous asset to the community without the Foundation's support, and we really appreciate their partnership. And this is the part I liked. It hasn't been easy, but it's been worth it.
And this is Maggie again, just to jump in here. I think, these are the benefits that we heard people talk about from KHFI participation, and obviously there were a lot of challenges, as this quote alludes to, in terms of participation and what that meant. The one really, for us, the noteworthy thing, the difference between last year's report and this year is that there was sort of reference to previous challenges in terms of figuring out what was expected and changing ideas of what was going to be required to be reported on, meeting the grant requirements. But those were all kind of referred to in the past tense when we talked to people this year. So certainly those challenges were still acknowledged. Those challenges delayed a lot of people's initial implementation, but it seemed to us from sort of how you all talked about the work and participation that most of those challenges were kind of overcame in the last year, and you were able to focus more on your programs. And so while certainly in the report those challenges are still referred to, we didn't spend as much time in this year's report kind of detailing out what those challenges were, because they seem to be waning.
And we hope that's true. So I alluded to this in the logic model a little earlier, where we talked about some of the short-term outcomes that the Foundation was interested in. And there were a number of them that related to increasing capacity or community capacity for the individual grantees. And these were really increasing capacity to implement programs, evaluate and monitor progress of programs, leverage resources to sustain programs, communicate about programs, advocate to meet policy objectives, as well as complying with federal requirements. And we asked you each year, we asked all the sub-grantees to sort of rate their own individual capacity as people working in these programs, as well as their organizational capacity in these areas over the past year. And we saw that there were actual increases across the board in every category except for one, around people's individual comfort or individual capacity to work with federal grants, to evaluate programs implementation, to evaluate their outcomes, to implement evidence-based programs, which all of these struggled to be and were in the end, communicating with stakeholders, as well as leveraging resources to sustain and scale your programs. So modest increases in money, but some significant increases in the areas of evaluation and compliance, which, because this was such an evaluation-heavy project and a researchy project, and because it had all of the ties to federal compliance that you could imagine, you would expect capacity to increase, and it sounds like you marshaled your forces and rose to the occasion and actually did change and saw changes. These are all articulated in the report on page 32 in Table 11, so you can see that for yourself.
And just the scale isn't marked here, so I just want, this was asked in the annual survey that you all have been completing in terms of increased confidence on a 5-point scale. Right. So with 5 being much more confident, 4 being somewhat more confident, 3 being confidence unchanged, and then 1 and 2 being less confident. So just so you can get a sense, it's reporting increased confidence since the beginning of SIP, and this is looking at the last 2 years' data.
See if I can do that. Woo! Okay, enough. On an organizational level, the same question was put to respondents in each of the programs around their abilities or around changes in capacity at the organizational level in these same categories. And while there were increases across the board organizationally, people started out at a lower level. As you can see, the blue markings in 2012 are significantly lower than they were in the previous year. Or markedly. I use that word loosely at this stage. And then there were some increases in each of these categories except fundraising, again, at the end. I think this reflects the stage that these projects were at the time that these surveys were conducted, and that as programs start to succeed in their fundraising elements, they may find organizationally that their capacity has indeed increased. At least that's what we hope to see. Now, there were benefits at the foundation level as well as challenges, and we've marked those out. but the four that were brought to light highest within our interviews with Foundation staff about what it meant to participate in a SIF project was that it actually did provide resources that allowed the Foundation to further its mission. And the Foundation is a mission-driven organization that has funding priorities that tie in strategically to its mission. And so this was not a cul-de-sac or a wrong-way turn for the Foundation, but did allow it to make some progress in furthering its mission. There were significant resources brought into Kentucky that would not have existed were it not for the SIF program. This was a matching program that matched at two different levels, and so every dollar that the federal government invested in a SIF project was matched once by the intermediary, by the Foundation, and then that combined total was matched in cash by the sub-grantees. That itself introduced many challenges into the initiative, but nonetheless really multiplied federal investment in a way that it hadn't been done before. It increased the visibility of the Foundation on the national scene, participating with other national foundations and international groups at a federal level for the Foundation was significant in terms of increasing its visibility in the national grant-making scene. And then it offered the Foundation an opportunity to build new partnerships through these new funding mechanisms with entities in the Commonwealth that they may not have had opportunities to fund previously. This was a takeaway lesson from the Foundation that Jeff talked about as he left to go to the Philippines to work in a hurricane zone. So out of the frying pan and into the fire for Jeff Franklin. But he thought that the participation was an investment in Kentucky as well as the Foundation. And it planted a seed and the harvest won't happen right away. These are long-term outcomes that they hope to benefit from, but don't anticipate benefiting from immediately. So coming down on the final end, there's one more report that we will be doing for the Foundation, which includes many of the same elements of data collection that we've engaged in all along. So in the next 6 months, we'll be doing our final data collection from both our independent primary data collection as well as using secondary sources from you all. This will all be analyzed once again, and we'll produce a final report at the end of the Foundation's year, right about December 31st. We hope to include all data from all programs, which the last one I think stops providing services at the end of September. And so we have the month of October, November, December to finalize these reports and do all the analysis of all your data. So that means that the final evaluation reporting is really tight and tightly scheduled. We've committed to reviewing any sub-grantees evaluation reports within a week and providing feedback to you before they're submitted off to the Foundation. And so are looking for a 1 month after the end of funding draft report for the finals from all evaluators on all projects, and then a final 1 month after that. So the final evaluation report from a KHFI sub-grantee will be finished at the end of November of 2014. This is what we'll be doing. As always, we review and follow up with you around your quarterly data submission so that we understand it and make sure we're capturing it together. All data collection efforts are sort of coming into line at this point, so there isn't as much remediation needed. We do know and we're reporting on sort of some constant metrics now, which is good. But we still need to have these calls just to make sure we understand exactly what we're seeing and ask questions about any errors that may have occurred. We'll review all of your progress reports and the final evaluation reports that are submitted and incorporate those into our report. There are 2 interviews that will happen with program staff. One is our exit interview right at the, end of participation interview right at the end of participation, at the end of your grant, and then about 3 to 6 months afterwards, depending on when your grant ended. We'd like to do a short interview with project leads about continued project activities, see what's happening after funding ended and whether or not your projections for sustainability are holding or whether they had to be amended. There will be a 3rd annual sub-grantees web survey, and we'll incorporate results from the last retreat. And then there is a a possibility, or we're looking at a few projects that we could put forward to some project experts to take a look at what's being done within the program status and all the program documents that you produce, and sort of make an assessment on terms of project, I'm not even sure what all the metrics would be, but mostly around potential for replication and scaling. That was potential for replicability and scaling in stereo. So I guess with those final comments, we've basically come to the end of what we wanted to present to you about this report. If there's anything in these reports that are of interest to you or that you have questions about or want to ask us about, that's what this webinar is for. We've reserved about 20 minutes at the end here to take your questions. So I'll just sort of leave some dead air and let somebody fill in and tell me what happens next.
Thank you. Ladies and gentlemen, if you would like to register for a question via the phones, please press the 1 followed by the 4 on your telephone. You will hear a 3-toned prompt to acknowledge your request. If your question has been answered and you would like to withdraw your registration, please press the 1 followed by the 3 on your telephone. You can also use the chat feature located in the lower left corner of your screen for a question. Again, to register for a question via the phones, please press the 1 followed by the 4. One moment, please. Again, as a reminder, ladies and gentlemen, to register for a question via the phones, please press the 1 followed by the 4. And if there are any questions on the chat, please go ahead with those. We have no questions via the phones. I'll turn it back over to you, Jessica.
Great, thanks so much. Everyone, I hope this overview has been really helpful for you, both as a cohesive group, but also for your individual sites and communities. And I hope this information helps you continue to tell your story and support you and your work as you move forward. Looks like we have a question via text. So, Ian, do we support a draft to you all before we submit a final copy to the Foundation?
Hi there. Let's see. Right after the last convening in May, or right at the beginning of this year, we sent out guidance to each one of the sub-grantees that had sort of a blow-by-blow. It was a written version of sort of that talk I gave in the retreat. And yes, there is a draft report requested. What we're trying to ask you to do is to complete a comprehensive evaluation report following your SEP for the entire period of funding, and that draft is due to us for review 30 days after the end of funding. This is where we crosswalk your report against your sub-grantee evaluation plan and see that all elements have been addressed, and that is a complete report. And then it also offers us an opportunity to provide some feedback to make improvements in the report to make it as good as we believe it can be, and you can make it. So yes, Melissa, 30 days after the close of funding, which in your case I think is we're a little confused about that. We thought it was the end of June, but it might be the end of September. We thought it was the end of September, but Rose thought it might be the end of June. And you may have had an extension. So just in your case, 30 days after the end of funding would be a draft. We would turn that around back to you within 7 working days, 5 working days a week, and then you could have the rest of the month to return it, the final being due 2 months after the end of funding.
Great, thanks. A couple other questions. Will programs continue to have access to the Foundation for future educational offerings? Teresa, I can answer that. Yes, we would love to keep you all on board as a partner, of course. So let me talk to Susan, since my time with the Foundation will end in December at the end of this project. But let me talk with Susan and the other program officers to see how we continue to keep our sub-grantees in the loop for other opportunities. For example, the workshop that we held for all of you, we invited other initiatives and other partners from the community too when we did the storytelling. So we'll make sure to keep you in the loop of other offerings, professional development opportunities, workshops that are available for you to come. I don't see any other questions. So I just want to say, Ian and Maggie, I know that you put a lot of time and effort into this presentation, and it's been really appreciated. Thank you so much for going over this. All of you listening, feel free to follow up, of course, with Ian, Maggie, myself. If you do have further questions, let us know. We're always available to support your efforts. And unless there are no other questions, thank you so much for being on the webinar today. I appreciate your time. And being a soccer fanatic, USA plays Ghana today, everybody, at 6 Eastern. So go United States.
Go USA.
And with that, have a great rest of your afternoon.
Thank you, everybody. Goodbye.
Thanks, Jess.
Ladies and gentlemen, that does conclude today's conference call. We thank you for your participation and ask that you please disconnect your lines.